Welcome to this patient educational video for prostate surgery. This video was developed by feedback from your doctor, who is part of the Michigan Urological Surgery Improvement Collaborative, MUSIC, sponsored by Blue Cross Blue Shield of Michigan, focused on improving patient care with our mission to make Michigan #1 in urologic care. This video will walk through expectations and care after surgery regarding physical activity, diet, JP drain, Foley Catheter education, and pain management strategies for your stay in the hospital and at home. If you have any questions about the information in this video, please let a member of your care team know. You will be encouraged to walk within 4 hours after surgery, as this will help early return of bowel function, promote effective breathing, mobilize secretions from the lungs, improve circulation to prevent blood clots, prevent stiff joints, and relieve pressure. The morning after surgery, you should be walking at least 6 times a day. A nurse or healthcare team member can help you. A good way to think about this is twice after breakfast, twice after lunch, and twice after dinner. After you are discharged, if you have a long drive home, you will want to stop to walk every 45 minutes. Once you are home from the hospital, it is very important to continue walking. While you are awake, you should walk every hour. It does not have to be far and can be from the couch to the fridge and back. Gradually increase the amount of walking each day as tolerated. After surgery, your healthcare team will start you on a diet of clear liquids and then slowly advance you to solid foods. Your team will monitor you to ensure you are digesting food correctly before you are discharged home. You will want to start small on soft, bland, solid foods. Eat half of what you would normally eat and take twice as long to do it. Be sure to drink plenty of water to stay hydrated and avoid soda or carbonated drinks. Once home, gradually build your diet from small to normal portions. If you start to feel nauseous, bloated, or have excessive belching, return to only having liquids or sips of water until this passes or you have return of bowel function. During bowel movements post-surgery, it is important you do not strain, as it can cause your incision to reopen. If you are having a hard time passing a bowel movement, increase your fruits and vegetables intake. Take a stool softener such as Colace or a laxative such as Miralax, and drink a glass of prune juice. Following this regimen can help prevent an ileus, also known as severe constipation, that can cause you pain and discomfort, and in some cases result in readmission back to the hospital. As part of your care during surgery, some patients will have a bulb drain placed around the surgical area that will exit through the abdominal wall near the stomach to drain excess fluid away from the surgical area. Most patients will have this drain removed the first day after surgery or before they leave the hospital. If your healthcare team decides the drain should be left in for longer, you will receive instructions on how to properly care for it at home. Leakage may occur around the site for a few days. This is normal. Continue to change the dressing daily and as needed for saturation. If the fluid becomes very bloody, has a foul odor, or looks infected, please contact your surgeon's office. During surgery, a Foley Catheter, a soft, flexible tube, was placed in your bladder to help drain urine during your healing process. You will be sent home with a Foley Catheter and come back into the office within 7 to 14 days to have it removed. It is important that the catheter stays in place during the healing phase until it is removed by a medical professional. Your healthcare team will connect your catheter to a drainage bag that collects urine. You will be given 2 drainage bags, a large one and a smaller one that can fit underneath clothing. The larger bag drains better. Try to use it as much as you can. If running to the store, you can use the smaller leg bag. Switch back to the larger bag once you return home. Avoid using the smaller leg bag overnight. You may experience urine spray or leakage around the catheter at the tip of the penis. This is normal as long as the bag continues to fill as well. You may also see some blood in the Foley Catheter urine, which may appear a pink lemonade color. This is also normal, but it should not be a red Merlot color or have large blood clots. Check the color in the tubing, not in the bag. You will want to empty your drainage bag at least 2 to 3 times a day or when it is 1/3 to 1/2 full. Your healthcare team will review with you how to effectively drain, change, and clean your drainage bag. To clean the catheter, use warm, mild soap and water from where it enters your body and rinse well. Place a small amount of bacitracin ointment around the tip of the penis to prevent irritation. Repeat 4 times a day until the Foley catheter is removed to prevent risk of infection. You will also receive a Foley catheter education packet to help you properly care for your Foley catheter and drainage bag at home. After your prostate surgery, you may experience some pain or discomfort. This is normal. While in the hospital, your healthcare team will provide you with pain medication through your IV or by mouth. When you are ready to be discharged, you may be prescribed with 6 or fewer or no opioids. This will vary depending on the circumstances for the individual patient. Most patients will not need to take all or any of their opioid pills and can manage with alternating between Tylenol and ibuprofen. The best strategy for controlling your pain after surgery is around-the-clock pain control with Tylenol and ibuprofen. Alternating these medications will allow you to maximize your pain control. Alternate 1,000 milligrams of Tylenol, 2 pills of 500 milligrams, with 600 milligrams of ibuprofen, 3 pills of 200 milligrams, every 4 hours. This results in a dose every 4 hours. For example, if your first dose of 1,000 milligrams of Tylenol, 2 pills of 500 milligrams, is at 8 a.m., at 12 p.m. noon, you would take 600 milligrams of ibuprofen, 3 pills of 200 milligrams. At 4 p.m., you would take 1,000 milligrams of Tylenol again, 2 pills of 500 milligrams, and then 600 milligrams of ibuprofen at 8 p.m., and so on, alternating every 4 hours while awake for 3 days. Do not exceed 3,000 milligrams of acetaminophen, Tylenol, in a 24-hour period. Only take opioids if absolutely necessary, and when your pain is not sufficiently controlled with Tylenol and ibuprofen in the first 24 hours. Do not take more than 1 opioid pill every 4 hours. Taking opioids, like even in the small amount you will be given, can have long-term side effects, such as opioid dependence, and short-term side effects such as nausea, vomiting, itching, constipation, confusion, sleepiness, and dizziness. Thank you for taking time to listen to this patient educational video on expectations and care after prostate surgery on walking, diet, JP drain, Foley catheter education, and pain management strategies for your stay in the hospital and at home. Your healthcare team is focused on providing you with the best possible care. If you have any questions about your care, please ask a member of your care team. To learn more about music and our other initiatives focused on improving patient care, please visit us at www.musicurology.com.